Thank you for tuning in to Chat with Mayor Matt, the City of Mount Vernon's podcast about news of interest around town. Today's date is Monday, January 11th, and today's program is about the COVID-19 vaccine. We're discussing this topic with Knox Public Health Commissioner Julie Miller and renowned cardiologist from Knox Community Hospital, Dr. Barry George. I have a couple of special guests here in the studio/office. You know both of them, I'm sure. Julie Miller is the health commissioner for Knox Public Health. And everybody knows, if you don't know Julie, you've been hiding under a rock over the last year. And the other one is my old friend, Dr. Barry George, who's joining us here. We're going to be talking about the COVID-19 vaccine and what is going on in Knox County in particular. So let's just open this first question up to both of you. What's been happening locally with this?
That's a great question, and I don't know if I've ever been called special, so that's nice. Thanks, Matt. I'm just really proud of the fact that Knox Public Health and both Knox Public Health and the local hospital have been able to get our vaccine out as quickly as we can. I want everyone to know that we, Knox Public Health, has received only 100 doses for the last 100 doses each week for the last 3 weeks. So 300 doses in total. And as of this afternoon, we will have gone through all 300 doses in vaccinating all those, what everybody hears is the phase 1A folks, our local healthcare providers, our public health professionals that work with the COVID patients, our local EMS, all our congregate care facilities that are outside of long-term care, so our group homes, those with special needs. We've been able to vaccinate all of them. We started yesterday afternoon with hospice and home health agencies, so we're really pleased that we've been able to get that vaccine out. I received mine on the 23rd of December, my COVID vaccine. It went well. I had a little bit of a sore arm and a little bit of a rash on my arm. I may be special with that. But overall it was it didn't affect me very much at all. I know we've given it to a number of employees, mostly our nursing staff who work with COVID patients, and they've had minor side effects from it.
Good. So. Doctor, are you seeing the same thing? How's the hospital responding to the vaccine?
Pretty much so. I, like Julie, got my vaccine fairly early. I got it on December 21st, and they actually took a video of me getting it, and they're using it as a promotional thing. But really, I didn't even feel getting the thing. The only thing I noticed was that, probably that evening I rolled over on my right shoulder, and it kind of woke me up because my shoulder was a little sore. But other than that, it's really... it was no different than the flu vaccine. It's
no different than your wife hitting you in the bed, right?
Yeah. Answer the phone.
Yeah, make sure it wasn't her, and then, it must be the shot, right? Can I just share, too? I'm looking at Barry and listening to him. I want everybody to know Barry is renowned cardiologist, but he's also on our Board of Health. So it's very important that people understand, too, that Barry supports our public health efforts as well. So he's going to learn what we've been doing, because I don't get to keep him up to date every day.
Well, we have a history, too, because he helped save my life.
Yeah, there you go. I figured
anyway,
that was it.
That's why I call him my old friend here. So. Okay, well, let's just jump. We've got a laundry list of questions, and information is power, and so we want to inform the public on what do they need to know about this vaccine. And there are people who are scared. Oh my gosh, we're going to have a zombie revolution here or something like that. So let's start with this question. First of all, let's explain what the Moderna COVID-19 vaccine is. Julie, can you start with that one?
Sure, I'd be happy to. It's one of the 2 vaccines that are approved in the United States. They're both emergency use authorization by the FDA, which means they went through the very same process for development that all other vaccines go through. They just, at warp speed, they just quickened the pace. There was a concerted effort and agreements by all the companies that they would do it at a much faster pace so we could get people vaccinated. Moderna is the one that we're receiving. I believe Knox Community Hospital is also receiving. The other one is a Pfizer product. And some people have heard that Pfizer product has to be kept at ultra cold, like minus 70 degrees. Ohio has chosen to send the Moderna product out, I know, to local public health. Obviously, they must be sending it to hospitals too, because of the issue of keeping it at ultra cold temperatures on that Pfizer vaccine. So we've gotten the Moderna, which doesn't have to be kept cold that cold. It has to be frozen, but not that cold.
Okay, good. But people do have a choice to take this vaccine. And Dr. George, I want to start with you on that. They do have a They can do this, but how do people take the vaccine if they want to, and do they have a choice?
Well, first of all, they most certainly have a choice whether to take this vaccine or not. My thrust, I guess, is that this should be an educated, appropriately informed choice, first of all. To kind of expand a little bit on what Julie was saying about the Moderna and the Pfizer vaccine, what I would like to do just for maybe a minute or two is explain in layperson's terms what a huge breakthrough this is in medicine.
Yeah.
It's called messenger RNA technique. Okay,
Glad you
Moderna
talked
has
about
been
that.
doing this since like 1976. Okay, is when this kind of breakthrough. It now has created a whole new field of what we call translational medicine. But basically, the reason that this vaccine was able to be developed so quickly is because it is a vaccine unlike very few others. It doesn't have a virus in it. It doesn't have a live attenuated virus. It doesn't have a dead virus in it. Okay, so there's no way that you can get the COVID infection by taking this vaccine. That's extremely important to know as a layperson, number one. Number two, this messenger RNA, what cool technology this is, because this is now the gateway to what's going to happen in the future. Don't be surprised if 10 years from now we have vaccines for breast cancer, for colon cancer, for coronary artery disease. This is the biggest breakthrough in medicine that I've seen in my entire career.
It kind of sounds
Seriously,
like a little
in your
bit of
entire
a.
career.
It
Absolutely.
sounds like a medical
Yeah.
smart bomb, if you will.
It is.
Yeah.
This messenger RNA, what it is, it's a ribonucleic acid, which is basically some amino acids stuck together that are custom designed, just like the key in your car or the lock to your front door. And what that thing, it's coated with a coating in the vaccine, and when that is injected, then your body sees that, okay, and it is incorporated in the cells in your body and tells that to make these little spiky things that are on the COVID virus, exactly the way they are on the COVID virus. And what that does is then that calls your immune system to arms. It sees this little spike that your cells have made, which doesn't infect you, but it's on the COVID virus. And you've seen the little pictures of the
Yep.
COVID spikes and all that stuff. So that spike then causes your immune system to build up antibodies. Okay? So then if you do come across the COVID virus, you got these antibodies that'll attack those spikes on the COVID virus so you don't get the infection.
Yeah. So it's telling the immune system what it looks like, what
Yeah.
the COVID virus looks like, and to
Yep.
attack it.
Right.
Yeah.
In layperson's terms, it's like, hey, I'm the vaccine, okay?
yeah.
You guys watch out for this, okay?
Yeah.
And I'm going to give you the artillery to watch out for it.
That is amazing.
Yeah,
That
it
is
really
really
is.
amazing.
Well, and when
Wow.
he says that, so that leads to another question you probably have, but when he says it calls your immune system to respond, well, Barry and I mean, our immune systems may be fairly healthy. I assume we are. And that's why we may have had a sore arm or a tight muscle or whatever. And it may be why some people feel fatigued afterwards. It may feel like people might run a little bit of a fever, that kind of thing, because your immune system is trying to, get ready and attack the COVID vaccine should it enter your body.
Sure.
So,
Yeah. Wow.
Yeah, along those lines, it was several of my staff members in the cardiac cath lab who have received the vaccine. They said, oh, man, I felt like crap the next day. And I said, and you know what my comment was? Good.
Yeah.
And they said,
immune
what do you
system-
mean? And I said, that means that it's working.
Yeah, exactly.
Okay, and you're getting an immune response already.
Good. That's great. Well, So how do people take the vaccine? What do they need to know, and where do they need to go to find out how they can take the vaccine?
It's all over the news, right? So which media do you
Which
watch?
media do we want?
So the vaccine has been made available in Ohio right now to hospitals, to local public health, and to some private chain pharmacies, so that they can get the vaccine into long-term care or nursing homes and assisted living. But all they need to do is watch the local media. So for Knox County and for the individuals that we will be vaccinating, we will have it on our website. We'll have it on our Facebook page. They can call in. However, we're not advising people to call in because we're not taking names for a waiting list yet. But we will get the vaccine to them. Whatever the phase we're in, we will let people know. We will let them know how they need to contact us or where to go to get that vaccine. But it's just what we call intramuscular vaccine. It goes in your arm. Most of us have had vaccines in our lives, so it's a very simple process. It only takes us a few minutes to give it. The long part, and I want people to really understand this, the long part is we ask you to wait 15 minutes after you receive the vaccine. So, for instance, the individuals that have been coming to us, we do a drive up so that people don't have to come into the building. We go out to their car, we give them their vaccine, and then they're parked for 15 minutes. And then we have someone who's watching the cars to make sure nobody raises their hand or honks their horn or flashes their lights to say they're not feeling well. Or you may come in, the hospital, I'm sure, is just, we've had people sit too just in the waiting area and wait for 15 minutes. And that's to make sure you don't have a severe reaction to the vaccine.
Right.
So it should be fairly easy. The hospital's obviously doing their own personnel right now, and they have a lot of personnel to go through. So
Right.
And we find the information on the phases on the Knox Public Health website.
Knox Public Health coronavirus.ohio.gov or the state's coronavirus
Yep.
website. Yep.
So, and the city will put some links on that as well. So
that'd be
we'll
great.
make sure to share that as well.
I'm sure the hospital has them up
Yeah.
too.
Yeah, right.
Yeah.
Just to expand a little bit on what Julie was saying also is that as of January 7th, 2021, okay, there have been 5 million people in the United States, according to CDC statistics, that have received the vaccine. Out of the 5 million, there have been 29 out of 5 million allergic reactions. No deaths.
You mean severe, like a
Severe allergic reactions.
Yeah.
No deaths, okay. They were all treated appropriately for a severe allergic reaction. That's pretty low numbers, number one.
Sure.
Number two, this vaccine undoubtedly is less likely to produce an allergic reaction than the traditional vaccines that have the egg protein in it or those types of things, that sort of thing. The only thing really in this that would be considered foreign to your body is what's called PEG, polyethylene glycol. It's kind of like a distant cousin of antifreeze, but you're not going to thaw out, okay? So that's not it. But polyethylene glycol is in numerous pills and medications that a lot
like
of us commonly
take. Kind of. It helps the medication work.
Yeah.
Right, and it does. It's kind of a vector in which we can help it facilitate it to work. Okay, that's really about the only thing that you can truly be allergic to in the vaccine.
Okay. Very good. Well, we've talked a little bit about who's eligible, and we'll have the phases shown at the different websites and the links and stuff. But is there anybody who should not get the Moderna vaccine?
I can tell you that as far as both of the vaccines and the information that the manufacturers put out, it's people who have an immunocompromised system now. Perhaps they're on cancer treatment, or have a disease that causes their immune system to be compromised, which would put them at risk. The Moderna vaccine specifically states that if you're on anticoagulants or blood thinners, that you should talk to your physician prior to getting the vaccine or not consider getting the vaccine. And past that, it's children, anybody under, one is 16 years of age, Moderna is 16 years of age, and Pfizer is 18 years and up. So any children should not get this
Okay.
vaccine, and I'm sure they're working on that to see how they
No,
can vaccinate
yeah.
children.
So what
As we speak, Moderna is doing that. They've already enrolled about 3,000 kids between the age of 12 and 16.
Oh,
The
wow.
other
Trial.
one too
Yeah.
is pregnant women, breastfeeding women. We recommend that they talk to their obstetrician before they get the vaccine, and there's studies going on both those things by both the manufacturers.
Yeah, the American Board of Obstetrician and Gynecologists have already stated, they've made a policy statement that, yes, you discuss it with your obstetrician or gynecologist, but they recommend that you get it.
The risk is greater
Yeah,
than
the risk is,
yeah.
right.
Now, are there any other? Is there anything else that people should mention to their doctors or about if they want to get this? What should the physician know, or what should the
Patient?
about the patient? I mean, you talked about someone who's pregnant and breastfeeding. You talked about someone who may be on blood thinners, looking at all the risks.
If you've had an allergic reaction to vaccine in the past, we would look at that. So if someone would come into our clinic and say, I had a bad reaction to a vaccine, we'd have to talk them through it. This one is completely different than most of the other vaccines that we've given. So we'd have to see what kind of reaction that was.
Okay.
But no, there shouldn't be anything else. If you're healthy and you meet the phases, you should be able to get the vaccine.
Yeah, I think it's important to understand also that the reason Julia was mentioning about anticoagulation, if you're on it, it's not because that's going to make the vaccine less effective or interact with the vaccine. It basically is that, when you stick a needle in somebody's muscle and everything, if you hit a tiny little blood vessel, you obviously, if you're on blood thinners, you may be more prone to bleeding. So you may get a little, we call it hematoma, or kind of like some blood in the soft tissue, okay, which, relatively speaking, not a big deal.
Yeah.
It's the story of my life since I met you. I have to say.
But
So.
again,
You know what I'm talking about, don't you?
Again, I'd remind people to if you call or come in and say I'm on a blood thinner, I would say to you, you need to call Dr. George and have a conversation with him about it, and he'll talk you through it. There may be some he wouldn't want to have the vaccine, but perhaps you are one that could. So we want them to check with their providers.
Yeah.
The other thing, too, as Julie mentioned, again, this vaccine is made differently than traditional vaccines. So if they've had an allergic reaction to previous vaccines, that should put us on high alert to look for an allergic reaction and be prepared to manage it appropriately, but it certainly is not a contraindication to getting the vaccine.
I think it's going to depend on how severe the reaction was. Really.
Correct.
Any of the side effects that you've been talking about a little bit, about the bruising and the feeling way down and so forth like that, just check with the physician, just check with your provider.
If you have them after the vaccine?
Yeah.
No, you don't have to. If it's something that you feel like you can manage at home, if you have a slight fever, you can take the typical Tylenol, Advil,
Okay.
whatever's appropriate. You just have to kind of push through it. You have to move through it. As I said, some of our healthcare personnel felt fatigued, or the cath lab staff felt fatigued. Okay, well, good. Well, that means your immune system's working. If you literally feel like you can't work, don't go to work. But, it's easier and much more important that you push through it. And it would be those severe reactions that you'd want to seek medical care for. And typically you're going to see the severe reactions within the first hour. And I can tell you, just based on my experience, within the first 15 to 20 minutes, you're going to see the severe reactions. An hour is severe, but it's not as severe as the first 15 to 20 minutes are as important.
Let's say if someone doesn't want to do the vaccine now, do they go to the back of the line then? How does this work out? If they're eligible and they say, no, I don't want it right now, what's the procedure on that when other people are available for
I
that?
can only speak for Knox Public Health. We're not intending to do that. That could happen just kind of in a natural sequence. So we've tried to do our best to reach out to all the Phase 1A folks that we need to. And like I said, we're going to go through all the vaccine we have. At the end of the day, all of those that we know of, the congregate care sites, group homes, EMS, we'll see what we have left to do, or who we have left to do, how many of those individuals, and then hopefully in our next vaccine distribution that we'll receive, then we will get them done. We hope, Knox Public Health is in great hope that we'll get more than 100 doses when we move to phase 1B. Because when you open up 65 and up, and there's 16,000, I think, in the county of people that are 65 years of age and up, and we have 100 doses, and let's say 50% of them want it, how are we, that's what we're planning right now, how do we distribute that vaccine if we don't have the number? But honestly, it's just a matter of, it could happen if we're busy doing 1B and somebody in 1A didn't get theirs, but we'll work them in. They'll get their vaccine. They may have to wait. And unfortunately, they must not have been paying attention, because if you aren't paying attention now, if you're in 1A, you need to be calling us if you haven't heard from us. Yeah.
Good. If you get the vaccine, Doc, I'm going to look to you. Does it mean you won't get COVID, or how much does it reduce the risk of you contracting the COVID-19 virus?
Well, I could get real deep into the weeds on that on this trial, but I'm not going to.
Okay, that's fine.
The bottom line is this, okay, if you take the first vaccine and then close to a month later, either 20 to 28, 30 days later, you take the second vaccine, your likelihood of contracting COVID is probably less than 5 to 7%.
Okay.
Okay, and which is, far better than most vaccines we got, to tell you the truth. So
the thing that we know that with such a quick turnaround too is amazing to me. How this vaccine turned around in such a short amount of time too.
Right, it is, and I can assure the public out there. I've been involved with clinical research for the last 30 years, primarily in biomedical devices, but also in pharmacotherapeutics and cardiac disease. And I've actually presented data to the FDA panel twice in my career. I assure you that the rigors of doing a clinical research trial with independent safety and efficacy monitoring of these trials, and the way it's done in the United States, it's no better. Okay, this is sound science, the best that we have in the 21st century. I have looked very closely. The data on the Pfizer vaccine was just published in the New England Journal of Medicine 2 weeks ago. The very, only doctors like us would be interested in reading that article, but it's very sound, and it was done in the usual rigors and fashion to approve this vaccine. So that's why I can safely say, there's only about a 5 to 7% chance you're going to get this thing if you take the 2 doses of the vaccine.
That brings something up that he said that reminded me, and I don't think we have it, on our list of things we wanted to talk about, but people, when you ask, can people still get it? It's really an unknown. The vaccine is new, but the efficacy is great. However, people can get I could get my vaccine today, or you could get your vaccine today, and next week you might have a symptom or two. You could be tested and you would be positive for COVID. That is not because the vaccine didn't work. It takes a little bit of time, up to 2 weeks, to build up that immunity. However, it's not the vaccine that caused you to be positive. You were exposed to someone who actually did have the disease. What it means, though, is your immune system is probably going to be even more pumped up, and you're going to have better response when you receive your second COVID vaccine. So we were just talking about that, and we had the epidemiologist from ODH talking to the health commissioners yesterday about that. So it was really interesting to know. They feel that if you get the vaccine, you had the disease, and then you get your second dose, and there's no reason you shouldn't get your second dose, that your immune system might be even 99% or 100% at that point. So,
along those lines too, Julie, there's a lot of discussion right now in regards to the vaccine, that if you have had the COVID infection.
Oh yeah, that's a good one.
Or like what you mentioned, okay. Right after I had my COVID vaccine, I went down to the lab and got a nasal swab. Okay, because I wanted to know whether I was negative or not.
Sure.
Because if I did get symptoms, I wanted to know whether it was the vaccine or not. Probably, 3-4 days later.
Doing your own research.
And yeah, exactly.
Yeah.
So just kind of personally, but I've been getting a fair number of questions on it. Well, gee, if I already had the COVID infection, should I get the vaccine? And the short of it is, the answer is yes. To best protect yourself and those around you, the answer is yes. The question is on timing, and there's still a lot of controversy out there and that sort of thing. In fact, just yesterday, I had one of our employees at KCH who had the COVID infection. They are now asymptomatic. They're out 2 weeks from the COVID infection, and should they take the vaccine? And I said yes. Now's the time. Go ahead and do it. Okay. The CDC is kind of waffling on this. They're kind of saying 60 to 90 days right now, but the CDC waffles on stuff the more information they get. So
the manufacturers are saying it's not gonna. If it's up to the person, right? It's choice.
Right.
We believe you have immunity if you've been infected with COVID for 90 days. We believe that you've been infected up to 90 days. So if somebody could wait 90 days, the problem is you need to get vaccinated, because after 90 days, we don't know there's really not enough data and evidence to say you won't get reinfected. We know that people have been reinfected. So, yeah, if you've had it, you need to still get it.
And along those lines, too, is that, this is an ongoing research project.
Yeah.
Okay. The CDC in affiliation with the federal government has it's called VSafe. Okay, and basically it's an online thing. They want to know day 1, day 2, day 3, day 4, day 5, and then weekly thereafter. How you doing? Did you have any problems? How you feeling? That sort of thing. And it's basically an app that you just every day put it on there. We need that information, okay, to learn more about, just how good this vaccine is, okay. We know how good it is to a certain point, but quite frankly, we don't know how long these antibodies are going to last, how good this vaccine is, and we need this information for future reference.
Did you sign up?
Oh yeah,
Use
I did.
the QR. It's real easy, Matt. QR code, scan it, put your name and a cell phone number,
Nice.
and they in fact, it was last night. They text me and said, "You've been 2 weeks out or whatever.
Correct.
How are you doing?" And it's real quick. 2 questions now.
Nice.
The first few days, they ask you a few more. Did you have a fever? And, just a few more questions. But that's the data we need, and it's really slick how they do it.
That's great.
So.
Real-time data that you just got, and you let technology do the heavy lifting for you.
Yeah, exactly.
Crunches everything. But I love that. I love that approach. So,
Yeah.
man. Well, we've got. So this is really exciting with the notion that we can prevent this from happening. One of the things I wanted to ask you guys that I think we've been through pretty much everything on the list, but one of the things I forgot to ask is we still have to be smart. We're not immune yet. We have, as a community, we have to continue to do things the right way to prevent this from spreading, from more practical hands-on types of things. Can we just review those things in case anybody's been living under a rock over the past year? What are really important things for people to know and remember to finish strong, I guess is what I'm asking.
This is a safe vaccine. It's been proven that it's safe. What'd you say, 29 million reactions, severe reactions?
29 reactions out of 5 million.
Yeah.
5 million.
Yeah.
Wow.
It's safe. It's important. This pandemic needs to end, and this is one of the ways we can build herd immunity. You've heard that. And public health is ready for this pandemic to be over. It's changed our lives. It's changed our lives in a lot of good ways that people don't see right now. The mRNA vaccine, how we spent more time at home.
Sure.
We learned more about technology in meetings, but I think it's important that this is the one way to help end this pandemic. And we won't get rid of masks forever. We will quit wearing masks at some point, but at least now when we have our professionals or the experts say, hey, we have an outbreak of this, you might want to wear your mask for the next month or 6 weeks. It won't be as a culture shock
Right.
as it was with this. So
And wearing the mask, socially distancing, washing hands
it's
frequently,
all-
rigorously,
yeah,
disinfecting
that'll never
everything.
go away. Yeah.
It's just kind of been a wake-up call to everybody, I think. So I know that the hospital is taking a lot of precautions as well in preventing that, and so is the public health. Businesses I feel are doing a pretty decent job around here as well. From when I get out and about, they're enforcing their rules, and so it's good to see that it's a community effort here. So.
Matt, here's the bottom line, okay? Either by technology, which we now have, or by the natural history and course of this disease that we are experiencing, we have to get somewhere between 70 and 80% of people in our country to have antibodies in their system against this virus, the so-called herd immunity that Julie was talking about.
Yeah.
And so, like I say, you either get infected and you get your antibodies and or you take the vaccine. And until we get to that percentage, okay, we are never going to get back to life as we used to know it. That's the bottom line, okay? We are going to continue with social distancing. We're going to continue with masks out in public. We're going to continue with the fear and anxiety of seeing family members when maybe we shouldn't, our parents, our grandparents, those types of things. So please,
Take the vaccine.
take the
Take the vaccine.
Okay, trust me, I'm a doctor. Ha ha.
That's the
Trust me, I'm a public health professional, and they don't trust us.
Trust me, I'm a politician.
Let me just add one thing, because I think we've gone through. I want to make sure that we spoke to myths. So thanks for leading the question.
Yes.
But the one question or the one falsehood that I know is out there is that they insert a microchip into individuals when we vaccinate. And I'm going to just read from a statement that the Ohio Department of Health put out about that. So the myth is that COVID-19 vaccines will implant tracking microchips in people. And the answer to that, or the fact is, vaccine injections do not contain tracking microchips. No vaccine injections or nasal sprays, including the shots for COVID-19, contain microchips, nanochips, RFID trackers, or devices that would track or control your body in any way. Much like the way any shipment or delivery is tracked, shipments of vaccine doses will be monitored because they have to make sure they're safe as they're shipped and administered. However, the notion that these shots will contain tracking devices implanted into Ohioans is false. And Barry, I just want to say, if they put, I don't care how big it is, a nano chip into my muscle through a syringe, my arm would not just be a little sore or a little, red or a little inflamed. It would cause me a lot of grief. So that's one way to know that. But we also have to trust the process, which you and I do, because we've been around a long time and we know the process was well done.
Yeah.
But no microchips, folks. If you have a cell phone, you're being tracked. So that's what I look at it.
Exactly. That was.
You have social media, you're being
Yeah,
tracked.
exactly.
Exactly. So it's real hard to get a nanochip through a 22 gauge needle. By the way.
Yeah.
Okay. I mean, you got to have a pretty big needle to get a nanochip injected. So.
Yeah.
Well, any other closing thoughts before we sign off here from either one of you guys?
I have one that I think we didn't touch, and I would like to emphasize to all the people out there, citizens of Knox County, my patients, and anybody else who's listening. Okay, I don't consider this a binary choice for the layperson and the non-medical person. I consider this kind of a three-way choice, okay? It's, there's a yes or no. I am going to take it, I'm not going to take it, okay? If you don't want to take it now, okay, that is your choice. If you want to lay back and see, how many survivors we have from the vaccine, that's perfectly fine. You have to do, it's like I tell my patients all the time, you have to feel comfortable with my recommendations, okay? If you don't feel comfortable with it, then don't do it, okay? Don't do it. But and I won't take it personal that you're not going with my recommendations. But this is, it's not a yes or no. It's a yes, no, well, maybe. Okay, and I in no way want to see people who are hesitant to take it be penalized in the future,
Right.
or have this
Right.
vaccine withheld from them if they do decide to take it.
And I think you said it early on, Barry. It's a make an informed choice. Go to resources that can be trusted. And as much as people right now with the government, struggling with
Sure.
trust of the government, I can tell you that the CDC.gov website, the Ohio Department of Health, website, and those resources, go to the ones you trust, but make sure that the research that they've done is credible. But I think it's make an educated choice. So if you are a no, have a good reason why you're a no. I have no problem with vaccine hesitancy. I get it. It did happen quickly. It's scary. It's new.
Yeah.
It's like any new medicine. I'm nervous if Barry would prescribe me I've never taken it. It would be a little like, oh, I hope this is okay. I hope it, and it's not against Barry. It's new
Yeah.
to me.
It's your body. You
Yeah.
gotta,
So I'd make an informed
Sure.
decision.
Yeah.
Matt and Julie, I've been relatively excited, but also disappointed in what I've seen with this pandemic. And by that I mean I have never in my entire career seen a disease process as politicized as the COVID pandemic.
Neither have I, Barry.
And it's between the politicization of the COVID virus coupled with social media and our ability to spread misinformation nowadays, it has created tremendous distrust amongst our leaders, physicians, those types of things. That's really a shame. And I hope that most people can understand that and see through that and make a wise and educated choice in regards to the vaccine.
Well, hopefully, we'll have some people tune into this podcast and start looking for in their own ways those trusted websites, those science websites, the CDC, Public Health. To name a
And I
couple.
would offer for them to, and I do on my Facebook Lives, for those who are always challenging whether our data is true, come and see me.
Yeah.
I'll show you how we collect it. Call me. I can give you the information so you can really see how it's done instead of guess how it's done. And so they can always reach out to Knox Public Health.
Well, and information really is power.
Yeah, it is.
That's
Yeah.
having the right information is key to this.
That's correct. And one other thing I wanted to mention, Julie knows about this. Matt, you don't know about this, but one of the beauties of living in a relatively rural community like we have here is that we have much more personalization
Sure.
in taking care of patients, in getting information out, and that sort of thing. That's one of the good things about living in a rural community. But with that being said, is that we have developed a program at Knox Community Hospital about college and high school athletes who contract the COVID virus and getting them back on the playing field as quickly, but more importantly, as safely as we can. There are multiple different kind of guidelines and recommendations that have been set out by the American College of Cardiology, by Ohio High School Athletic Association, by the NCAA, that has left our community kind of in a quandary. So we basically developed a back to competition program that I've gotten to know a lot of the athletic directors here in Knox County, a lot of the coaches, a lot of the kids, for that matter, and it really has gone well, and I think the community overall really appreciates that. So the accessibility.
Just to piggyback on that, it has been a body blow to this community to not have athletics and not have theater and not have music and art. It's just something we've really missed, and so
Oh, I
This
know.
the stress, the urgency of
know.
getting us back on track to be able to enjoy those things
Yeah.
that offer the escape from the realities, if you will.
Yeah.
So yeah,
And I'm hoping so this is one thing, Barry, if we can get people to take the vaccine, hopefully some people will feel more comfortable taking the vaccine after listening to Matt's podcast, then we could return to the Music and Arts Festival and all the stuff that people enjoy so much, Ariel Foundation Park, and just the fair for goodness
Exactly.
sake.
Yeah.
You know, this is one way to get back to, quote, normal. So.
Yep.
the water park.
Oh, the water park.
God.
Yeah, I forgot about the
We
water
had
park.
something funny. I mean, interesting. Not surprisingly, but we had several permits come in to put in backyard pools after
yeah,
this past year.
yeah.
So, anyway, it broke my heart to see kids out running through the sprinklers.
Yeah.
But
No, we did the right thing.
yeah. Anyway, so
But we all want to get back to life as we knew it.
Yeah.
exactly.
Okay, and take the vaccine. I'm maybe a
We'll
little
get
flippant
closer.
here, but if you
Yeah.
want to get back to life as you knew it,
Yeah.
take the vaccine.
Yep.
Yeah.
Good.
Totally agree.
Well, we're going to close out this podcast, but before we sign off, I want to officially congratulate Knox Public Health for being awarded the Business of the Year through the Knox Chamber of Commerce Awards Banquet this past Friday night. You saw a virtual showing of that on YouTube at the Chamber's website, so if you haven't checked it out, you can see that. And also, particularly to our very own Julie Miller, who was awarded the Lifetime Achievement
Yeah.
Award. Julie, congratulations.
Thank you. Thank you so much.
So, anyway, this is Mayor Matt Starr with my esteemed colleagues here, Julie Miller, Knox Public Health Health Commissioner, and my old friend, Dr. Barry George. I've been under his knife a couple of times by now. With Knox Community Hospital, wonderful cardiologist, great friend. Both of you, thank you so much.
You're welcome. Thanks for having us.
You're quite welcome, Matt.
Yeah.
Until the next time,
Julie,
stay
thanks.
safe, stay strong, and stay smart. Be sure to check out our previously recorded podcasts, all available on demand at mountvernonohio.org. Look for the Media tab. You'll find press releases, videos, and podcasts. Thank you for listening. Thank you for listening. Thank you for listening. Thank you for listening.